Hello, my name is Kwiecien, one of the resident faculty here at Spirit Education, and welcome to a team course on dental occlusion. This course is actually one of 4 courses. The other courses are going to specifically look at occlusion and muscles. There will be a course looking at occlusion and joints, and then a 4th on occlusion and the teeth and periodontium. This first course, however, really is just going to focus on a general global view as to what is occlusion and really why do we care about it. In this course, we're going to specifically talk about the correlation or the connection between dental occlusion and comprehensive dentistry or predictable dentistry and how that works into the comprehensive exam. And we're also going to look at the connection between occlusion and systematic treatment planning or facially generated treatment planning. And then finally, I want to touch on the 4 components of occlusion and how this system in and of itself is not exactly perfect and how we have to deal with that. So in this first lesson, let's spend some time talking about comprehensive dentistry and the comprehensive exam and how that relates to predictability and occlusion. But first, let's talk about occlusion, because when we think about occlusion, oftentimes we think that's what we check when we are done doing a restoration or a crown. That's when we check the bite, we're checking occlusion. So we have our patient tap on their back teeth, and we want to make sure that it feels good to our patient before they leave the office. So it's really just squeezing on our back teeth, sort of like the picture you see here. And as we look deeper into occlusion, what we might find that there might be some spots that the teeth should touch that will be more advantageous for our restorations to feel better or to last longer. In other words, there might be a spot where, say, a top cusp tip should come down and touch the bottom tooth in a certain spot, or conversely, that a bottom cusp tip should come up and touch the top tooth, the tooth above it. And there might even be several spots on that one tooth, 2 or 3, or maybe even 4 spots. So you take that and then you look at the entire mouth like that, and it gets a little complicated sometimes. In fact, sometimes it seems a little bit overwhelming to think about to get all of those dots touching perfectly. But that's the fun part of occlusion. And so when we talk about occlusion today, I want you thinking at least about that. As if that's not complicated enough, sometimes we forget that, yes, our patients actually move their jaw. They move it from side to side and teeth rub against each other, and that's occlusion too. And when those teeth move against each other, are there spots that are more advantageous to touch at that point? Should front teeth be touching when we slide side to side, or what happens if back teeth touch when we move side to side? And how does that look? So when you look at this photo here, and you really start to see that it can be a little messy in the back, where there might be some teeth touching where they belong. Those dots are in the right spot in the back, and the front teeth are rubbing on each other. And this is what I want you to think about, at least for this lesson when we're talking about occlusion, is where are the dots touching and what happens when moved side to side and what should be touching. And when we talk about comprehensive dentistry, what we're really looking at is trying to find a way to be more predictable, or for our dentistry to last longer, so more long-term dentistry, or for it to be more individualized. And of course, we want it to be functional, and we want it to be aesthetic, and we want it to be healthy. Well, when we look at all 6 of those words, literally, and we could put more words in there probably, but when we look at those 6 words, let's think back about occlusion and how occlusion plays the role in every one of those. We want it to last longer. It's probably going to last longer if it's functional. We want it to be more aesthetic. Well, actually, teeth that look good usually function a little bit better, and teeth that aren't functioning so well usually don't look so good. So again, look at those 6 words and think, gosh, all of a sudden the role of occlusion in comprehensive dentistry is actually pretty important. And that's why we're going to talk about occlusion in general today. It seems to be sort of this umbrella that covers all of comprehensive or predictable dentistry. A nice example of that I want to bring up, and it's sort of an extreme, but it's going to prove a point, is a patient of mine from a little while ago. His name is Alex, and as you can see from the photo here, Alex has some chipped worn upper teeth and some chipped lower teeth. He also has a molar on the back that the porcelain's broken off. And yes, he's got some old class 5 restorations that you can see, but they're not in disrepair. But he's worried about his teeth breaking down. And when we look at the way he's currently functioning, as you can see here, there are some concerns. And so now let's go back to those 6 words we talked about. If we want it to be predictable, we should probably look at his bite. If we want it to last a long time, probably his bite's going to be a big part of that. If we want it to be aesthetic, it's probably going to be a big part of that. So you can see, again, all of this comprehensive, all of these terms we talked about, really occlusion plays a big role. And so as we finished his case, or as I finished his case, again, you can see some of those dots we talked about in the back, and you can see that getting his back teeth to touch evenly and simultaneously made everything more predictable. It's going to last longer. But his teeth also move. And so what you can see from this photo is that, yes, we had to look at what his front teeth were doing when he rubbed his teeth against each other. And really, occlusion was basically played a role in all of his treatment to make sure it was individualized and functional and long-term. Another example that might help to sort of bring it all together is this patient here, Denise, and when she came in, she really was concerned about the spaces between her front teeth, and she wanted the spaces filled. Well, again, if we don't take a comprehensive look, we may not have seen the bottom teeth that there seems to be a lot of wear. And what does that have to do with? Well, it has to do with occlusion and the way her teeth are rubbing against each other, which might be causing the spaces. Or if we went in and just did those veneers, they'd probably fail pretty quickly because we didn't look at what was going on functionally with the occlusion, right? So this comprehensive approach and occlusion seem to go together. And one last example I want to show you is, again, if a patient walks in, and obviously he's probably concerned about his front tooth, his name is Dan, and he was worried about that dark front tooth and some of the spaces. But the thing I want you to also notice here is if we're going to come and correct any of that, and we see the recession up on the cuspid and the central, and all of a sudden we think that, is there a possibility, would you be open to the possibility that occlusion, or the way teeth rub against each other, might be playing a role in why the periodontium is looking like that? Because if there are forces directed on teeth in one way or another, or constant breakdown, then it's going to really start to break down the infrastructure or what's holding the teeth in. So again, occlusion can play a role in the periodontium as well, and if we don't take a comprehensive look, a comprehensive approach in looking at it, then it's probably going to backfire on us as well. So again, this whole thing about occlusion, it really plays a huge role in our comprehensive dental practices. So it suffices to say that maybe one of the things we're looking at is how to, when we take this comprehensive approach, is to find out what is appropriate for our patients, right? Because every patient is different. So let's break that down into the 4 categories that we use here at SPEAR, which is aesthetics, function, structure, and biology. And what is appropriate in all 4 of those categories. And how do we find out what's appropriate in all 4 of those categories? Well, really it's breaking it down even a little more simplistic and saying, you know what, what's appropriate is understanding what the patient's desires are based on their temperament and current circumstances and goals in life. Then we have to do our job by making sure we collect the data, doing our clinical exam confidently and competently. And then we've got to find a way to actually treatment plan appropriately. So our skills as a dentist to visualize the end before we begin. And it's really when we combine all 3 of those that right in the middle there is what's appropriate for our patients. So I hate to belabor the term comprehensive dentistry, but again, that's what we're all about here, and that's what you are in your practice. And so when we say we're comprehensive, the role that occlusion plays in comprehensive dentistry is huge. And if you look at this patient here, and we're trying to find out what's in this patient's best interest long term, and what's going to last long, and what's going to feel good, and what's going to be functional, it really is always a riddle. And the main overlying theme of identifying or solving this riddle, it really is occlusion. And so I hope in this first lesson you can appreciate the role of occlusion in comprehensive and predictable dentistry. I'll see you next lesson.